Well, we're here today with Dr. Jones, a dentist from Villa Park in Orange County, California. How are you doing, Dr. Jones?
I'm doing great, thank you. Nice to see you.
Yeah, we're not too far apart here, actually, only about, 100 miles or so, and the sun is shining where I am. What about you down there? Is it shining too?
It's a beautiful, warm day today, about 85. Yes, beautiful.
Exactly. Perfect. So, Dr. Jones, I have a question here. You're a dentist, and most of us people who are not dentists, we sometimes, on one hand, sometimes we think a dentist is a dentist, and then we usually find out that that's not quite true, or we already know that a dentist isn't a dentist. But tell us a little bit about your philosophy. I think it sometimes has more to do with philosophy rather than with physical, clinical availability, because everybody has most new machines, not necessarily all, but it's a philosophy. So tell us the philosophy in your practice. If I come to you and let's just say I have kids and let's just say I have a grandma I want to take care of also, and I'm the responsible person just in that age where, you have dependencies and you have, left and right, older and younger ones, what can I expect? And maybe as you go along explaining us that, maybe you have a story about how did you become a dentist, Dr. Jones? What made you becoming a dentist? I'm always interested in what make people going into a field in which they're in it.
Well, thank you for asking. First of all, my philosophy is that, yes, I am a dentist, and yes, I have the training and education that allows me to practice and the licenses to practice dentistry in California, but my philosophy is that I am a service-oriented practice. In other words, I'm here to help my patients get what they want according to their oral health and what they want to achieve. I'm not here to dictate to them exactly what I want them to have. I will definitely give my opinion, but I see myself as an adjunct service provider for them to help them get what they want. I became a dentist because I wanted to personally help people get and stay out of pain. I have personally experienced severe tooth pain, and I know how personal that is. And I became a dentist so I could help people avoid that. And if they happen to find themselves in that situation, to be able to correct that for them and to take them out of that pain.
Got it. Oh, wonderful. So let me ask you. So, you want to give people a choice of what they can do. But at the same token, going to a doctor, dentist, you guys do have a doctor title there, we do not come to a doctor the way I, let's say, go to my a sandwich store and, the guy says mayonnaise, mustard, lettuce, yes, no, white bread, and I can make all the choices there are. Having a hard time making them, frankly, but I don't think dentistry is quite that way in terms of like choices. I'm sure there are certain things you need to push the people in and say this is what you need. Am I right there?
Exactly. In fact, you used the term doctor. Actually, the term doctor comes from the Latin word that we use for doctrine, and that means a teacher. We're teaching something, and so most of all, as a doctor, I feel like I'm teaching my patients. I'm teaching them what the best is for their overall health, and not necessarily the best for the next 2 or 3 months, but what about the next 20 or 30 years of their life? And if they happen to be older and they want to not proceed with maybe recommended dentistry, people are living longer and longer, and the last thing they need is for a mouth problem or a tooth problem, so they can't eat and they can't give themselves the nutrition that they need to continue their life as healthy as possible. So, yes, I do see my role as a teacher to teach them what is the best for them and what overall is going to give them the highest rate of success for healthy living.
My hat up to you, Dr. Jones, because there are very, very few doctors out there who actually know the derivation of where the word doctor comes from, which is teaching, doctor to teach, and very, very few know that. Everybody says, well, it's a healer and all that, and those definitions are correct, obviously. It's and you in the teaching, that's one thing. If you, for instance, go to the Buddhist things, they call it being enlightened. Well, that's what it is. An enlightened patient goes, if I don't do this, this will happen. Now, do I want to take this chance? And frankly, it's like whether you buy stocks or not. Some topics maybe are more difficult to enlighten. Some topics are more important to get enlightened to your future. Some not so much. But that's basically what it is. I love it. Wonderful. And, to round this up, if I have teenagers, even young children, let's just say 2 or 3 years. I don't. My wife and me, 25 some years married, but we do not have children. But anyway, so let's just say somebody has children, somebody has a grandparents. Do they all fit into your practice? Are you doing dentures? Are you doing implants?
Absolutely.
Are you seeing 2 or 3 year olds?
Absolutely.
Are you seeing 2 or 3 year old children?
Absolutely.
Are you
Absolutely.
Are you putting braces on
Absolutely.
on teenagers? Good. If I have a periodontal disease coming up, will you be able to fix it?
Absolutely. Yes, we're a full service general dental office, restorative, cosmetic, periodontics, Invisalign braces for the whole family. We see many generations. In fact, we have a family that's 4 generations. They come to us, the grandparents, the parents, the kids, and now the kids' kids are coming to us. I've been a dentist in Orange County now for over 25 years, and the families that I've had the opportunity to know and to help stay healthy as far as their mouth is concerned, it's just been very rewarding for me. And then for them to bring their kids and for their kids to bring their kids, it is very rewarding to me.
Wonderful. Also a very unusual thing for people to live so together. Both my wife and me, our families are so scattered over. There are no 3 generations in reaching time at all. But that's wonderful.
Yeah, that's very rare.
Yeah, that's great. It must be rewarding to have a little girl growing up, putting her first tooth, put her braces on maybe, and next thing you know is tell her what she needs to do to stay healthy so her baby gets healthy, and then next thing do the same for her baby. That must be something. Well, wonderful.
All of that.
Wonderful. Dr. Jones, thanks for letting us know, and we're going to talk a little bit more about specific issue, be it periodontal disease, be it all kinds of things, and see what people can do there. So let's do some teaching and some enlightening to your patients who maybe not even yet had the pleasure of coming to you. Thank you very much.
It'd be my pleasure.